Welcome to Rwanda Medical Academy, signs that prompt you to suspect a fracture. Have you ever wondered how to identify a fracture? Good, we have the answer. Use the mnemonic fracture to help you remember. Before delving into details, what is a fracture? A fracture is a break or disruption in the continuity of a bone, often resulting from excessive force, trauma, or stress. Recognizing a fracture promptly is crucial to ensuring proper treatment and minimizing further injury. There are several signs that can suggest a fracture, and today we're going to explore these using the handy mnemonic fracture. So stick around as we delve into the world of fractures and their telltale signs. First, we have F for focal pain. Focal pain, in essence, is a localized sensation of discomfort, distress, or agony. When dealing with potential fractures, it's crucial to note if the pain is concentrated in a specific area. This could signal a break or crack in the bone at that very spot. It's the body's way of raising a red flag saying, hey, something's not right here. So, when assessing for fractures, always take note of any focal pain. Remember, F for focal pain. Next up, R for reduced range of motion. In the context of fractures, reduced range of motion refers to the limitation in the normal movement of a joint or limb. This can be due to pain or a mechanical obstruction caused by the broken bone itself. When a fracture occurs, you may find it difficult to move the affected area as freely as you could before, indicating a possible disruption in the bone's continuity. So, R stands for reduced range of motion. A stands for angulation or abnormal alignment. This is when a bone bends or tilts abnormally at the fracture site, causing a noticeable deviation from its normal alignment. A deformity may be present, making the injured limb or joint appear misshapen or misaligned. This can be a clear sign of fracture, as the bone structure has been disrupted. So, if you see an unusual bend or misalignment in a limb or joint, consider the possibility of a fracture. That's A for angulation or abnormal alignment. Now let's look at C, T, and U. Crepitus is a unique sensation or sound that can be felt or heard when fractured bone ends rub against each other or surrounding tissues. Think of it as a grating, popping, or crackling sensation during movement of the injured area. Next is T for tenderness to palpation. This refers to the pain experienced by the patient when the injured area is touched or pressed gently. It's a clear indication that something isn't right below the surface. Lastly, U stands for unusual swelling. Fractures often result in localized swelling due to tissue damage and bleeding around the injured area. If you notice an unusual swelling or bruising, it might be a sign of a broken bone lurking beneath. So remember, C for crepitus, T for tenderness to palpation, and U for unusual swelling. These are key indicators that should raise your suspicions about a possible fracture. Finally, we have R and E. R stands for redness or warmth, and is a sign of inflammation, which is a natural response to injury. When a bone fractures, the increased blood flow and immune response to the area can cause the skin over the injury to appear red and feel warm to the touch. This is a clear indication that your body is trying to heal the damage. Moving on to E, which stands for ecchymosis. It's a fancy term for a common symptom we all know as bruising. When a bone breaks, blood vessels in the surrounding tissues can be damaged, causing blood to leak out and pool under the skin. This results in a distinct discoloration, ranging from blue and purple to yellow and green as the bruise heals. So if you see sudden unexplained bruising, it could be a sign of a fracture. And that's R for redness or warmth and E for ecchymosis. So to summarize the fracture mnemonic, let's quickly recap the key signs of a fracture. Focal pain refers to discomfort in a specific area, signaling potential damage. Reduced range of motion can indicate a fracture, as the break might limit movement due to pain or obstruction. Angulation or abnormal alignment points to a possible fracture with the bone deviating from its normal alignment. Crepitus is that grating sound or sensation when fractured bone ends rub against each other. Tenderness to palpation is the pain experienced when gently pressing on the affected area. Unusual swelling, bruising, or a wound could mean tissue damage from a fracture. Redness or warmth speaks to the inflammation associated with a fracture. Lastly, ecchymosis or discoloration caused by bleeding under the skin is another sign to watch out for. With the fracture mnemonic, you are now better equipped to identify the signs of a fracture. Thank you for learning with us. At Rwanda Medical Academy, knowledge is power and value.